Hi, welcome to your pet's pre-anesthetic consult. While this video is playing, your pet's going to be in the treatment room getting a blood, urine sample, and ECG, plus or minus some chest x-rays, and that's all going to be done for safety for the anesthesia. While that's going on, I'm going to walk you through what a typical anesthesia and surgery day looks like. The point of this consult is hopefully to give you some comfort in knowing what happens. It's totally normal to be nervous when your pet's undergoing anesthesia. You wouldn't be normal if you weren't nervous about it. So I'm going to walk you through what a typical day looks like. So it's usually a full day procedure for all of our surgeries or dentals. We do a drop off in the morning and then a discharge later on at night. We always ask that the morning of surgery that you fast your pet. That means no food in the morning. You can feed them up until midnight, but no food in the morning. And the point of fasting is it reduces the risk of aspiration pneumonia. Aspiration pneumonia can happen under anesthesia when the patient involuntarily regurgitates food from their stomach, which goes up the esophagus and then can go down the trachea into the lungs. So gastric fluids in the lungs are not a good idea for surgery. So one of the things we do to reduce the risk is fasting in the morning, and they do it in human medicine too. So no food in the morning. Second thing is we're going to send your pet home with a pre-appointment sedative. For our dog patients, that's trazodone. For our cat patients, that's gabapentin. And these medications help to reduce anxiety of traveling, coming to the vets, and then also being in a new environment. So it just settles them down. So once you've given your medication, hopefully between 6 and 6:30, then you're going to meet us for an admit appointment. Admit appointments are usually between 8:30 and 9 in the morning. We have a set list of questions or a questionnaire that we ask all of our pet owners. So it's pretty standardized. We make sure it's the right patient, right procedure. We see if you have any concerns you want to bring up. We see if you want anything else done while they're here under anesthesia. So nail trim, anal cleanse, anything else. We also get your phone number for the day. It's super important that you keep your phones on your person, ringer on. It's the only way that we can get a hold of you if something happens, or if we need to get a hold of you for something like we find an extra tooth that needs to come out, or we find a lump that needs to be aspirated. So we really need to be able to get a hold of you. We also will go over estimates with you just to make sure you're okay with all of the items, and we'll go over consent forms for anesthesia and surgery. The last thing, just so you're prepared, we do ask resuscitation orders on all of our pets. It's very unlikely that we will need to use these, but we'd like to know what your wishes are. So this means if something were to happen and we needed to do CPR, would you want us to go ahead and do it? So for most of our healthy patients, it should be a yes. Of course, it's up to you to decide. From there, you'll go home or go to work and try your best not to worry about things. It's totally normal to be nervous, but just rest assured they're in really good hands with us. Once you've gone home, our dog patients are welcome to trot around the treatment area to get accustomed to the area. Dogs love to suss out the area, so we let them sniff around, and then they'll get put in a dog ward, which is in the back of our treatment area. And they'll get their own little hospital bed for the day. So the smaller dogs get put in a little kennel. You're welcome to bring their favorite bed or blanket with them, and that will be their little space for the day. The larger dogs get tied up on a tie station. So there's a little metal ring in the room where you can tie their leash to, and that will be their bed for the day. Our cat patients, completely different. Our cat patients, we keep them in their carriers and bring them right into the cat ward, which is totally separate from the dog ward, and they get their own little private kennel, and we even put privacy curtains over top of their kennel door so they feel nice and cozy. Both dog and cat ward have feel-good plug-in diffusers that have pheromones to help relax them. We also have dimmers on all of our wards too, so we can adjust the lighting to make them more comfortable too. From there, we will start the procedure by checking their vital signs. We check temperature, heart rate, blood pressure, breathing rate. weight on all of our patients for baseline. The doctors on duty will listen to their heart and lungs, make sure they sound good, no new changes, and then we'll review the blood work, urine, ECG, and chest x-rays just to make sure that everything looks good. If we're happy to go ahead, then what we do is we give them an injection in their bum muscle, and that's called the pre-medication. And that usually contains half an opioid for pain relief and half of a sedative. And within 10 minutes, they're usually nice and relaxed. They should be pretty sleepy from their pre-med. And from there, that's actually the first time that we will lift them out of their ward or bring them into the treatment area. So now that they're nice and sleepy and they don't really care too much about what's going on, we'll bring them out into the treatment area and then get them started and ready for surgery. All of our patients get an IV catheter placed, so we're going to shave a little bit of hair on their forearm usually and place an IV catheter in, which gets taped in place. That IV catheter is mainly for safety. It's where we give all of our anesthetic agents. It's where we give our emergency drugs. And it's also where they're going to be hooked up to an IV. So they'll have their own little IV bag with a little line and a little pump, and they're gonna get surgical fluids throughout the surgery. And that's used to keep their blood pressure up and keep them safe during surgery. So now they're hooked up to their IV, they've got their IV in, and we're gonna start surgery by giving them their induction agent. That's the count backwards drug. So we'll count for them, they won't count, we'll give them that drug, and within a couple seconds, they will then be unconscious. And once they're unconscious from the induction agent, then we're gonna take a breathing tube, an endotracheal tube. It's a clear plastic tube, different sizes for different animals, and that gets put into the trachea, and that's to maintain the airway, to keep the airway open. The piece that sticks out from their mouth gets attached to our anesthetic machine, so there's a hose which connects to our anesthetic machine, and then once that's connected, we turn the oxygen on, and then the anesthetic on. And the two gases are mixed together, and that's what they breathe to stay under anesthesia. Most animals will breathe on their own, but there is a bag that you can breathe for them with if they breath hold or decide not to breathe. So we've got them covered that way. Once they're under anesthetic, then we start charting. So we have an anesthetic chart. It's a grid with time on the top and then numbers on the side. And every 5 minutes or every little square on that anesthetic chart, we check all of their vital signs. So temperature, heart rate, blood pressure, breathing rate, every 5 minutes, which is a standard of care. So once they're under anesthesia, we start charting. Anesthetic monitoring is only allowed to be monitored by veterinarians and vet nurses. We're the only ones who are trained to do this. No one else is allowed to. We go to school and we learn how to do this. Usually it's the vet nurse who's doing the anesthesia because the vets are busy doing surgery, but we're the backup just in case they have any questions. So now we're under anesthesia. We're doing really well. We've got a good set of numbers going, and we're gonna further prep for surgery. So if your pet's gonna have a surgery, then we will have to do some shaving and prepping and cleaning. If your pet's getting a dental cleaning, of course, they're not gonna have that. They're just gonna go right to getting some dental x-rays. You can watch the next video to hear a little bit more about your pet's surgery. During anesthesia or surgery, we're monitoring them throughout. We have a monitor that records values of their vital signs, plus the vet nurse is doing the anesthetic monitoring, so they're kept safe at all times. When we are done surgery or the dental procedure, we then turn the anesthetic off. So we turn the knob for the gas anesthesia, and then we allow your pet to wake up from surgery. Once they are feeling awake enough to start looking around and swallowing, that's our cue to take a breathing tube and then to remove it or to extubate them. And that's generally when we give you a call and let you know that everything's gone well and you can relax a little bit. From there, they're not out of the woods. We actually move to the back of our anesthetic record and enter what's called the recovery period. It's the 1 hour post-op or post-surgery where we continue to monitor them every 15 minutes. We check all of their vital signs, temperature, heart rate, blood pressure. They actually get put on a timer system so that a beep goes off and it alerts our team that it's time to go and check their vital signs. And we're checking vital signs, body position, mentation, just to make sure that they're recovering properly from their anesthesia. That's kind of when things can happen, so we really keep a close eye on them. While they're in their post-op recovery period, they usually get their IV fluids for the next hour. At the end of the hour, we generally then relax even more. And then that's when we take their IV out. We put a cone collar or onesie on for the surgical patients. We give them a bit of food, water. If they're a dog, we'll take them out for a little pee. And then we relax even more. We usually keep them for the next couple of hours just to wake up a little bit more. And then discharge times, usually the end of the day between 5 and 7. So we'll set up a time for you to come and pick up your pet. When you get here, we're gonna go over a set of discharge notes. So we print home care notes for all of our patients. It's got all of the stuff you need to know for aftercare or recovery for that surgery or dental. So we'll go through all of that with you. And basically that's it. After that, they go home with you. They're gonna feel really groggy that night. That's totally normal. Usually by the next day, they're feeling a little bit better. For some of our patients, we do rechecks, mainly for surgical patients or our dentals who get extractions. So we'll let you know when to do the follow-up, but we sometimes do rechecks for those patients. Anyways, that's pretty much it for the anesthetic portion. Next thing I just want to quickly touch on are what are the risks of these procedures. So again, it will vary depending on what's done, but for all anesthesias, risks are usually pretty minimal for our low risk procedures. So young, healthy animals or patients that are even a little bit older and have normal blood work, the risks are pretty low. That being said, they can have reactions to medications. They can have allergic reactions to medications. They can also aspirate, so they can vomit involuntarily and that stomach fluid can go into their lungs despite all the things that we do. So those are all possibilities, pretty unlikely, but possible. I always let people know anesthetic death is always a possibility as well. It's very unlikely. The statistic for it in vet medicine ranges from 0.05 to 0.1%. So I usually tell people to hear it and then just try not to focus on it too much. We have to let you know that it's always possible. They are live animals. You cannot make the statistic 0%, unfortunately. The last thing is bleeding and infection. So if your pet's just getting a scale and polish of their teeth and no extractions, this is not a risk. But if they're getting surgery, spay, neuter, or if they're getting a dental with extractions, bleeding and infection are possible. I generally tell people as long as you follow the home care notes to a T, so don't let them look at their incision, don't let them rub at their face if they've had extractions, they should be just fine. That's pretty much it, guys. I hope this has made you feel a little bit more comfortable about the procedure. If you have any questions, please ask us. A vet assistant or vet nurse will come right in shortly with your pet and they'll just go over the medications for the pre-appointment sedation, and they'll also go over that they have a little bandage on their leg where the blood draw was, so they'll just let you know what to do with that. We do recommend you take it off when you go home. And if you have any questions, our doctors and vet nurses are here to answer any of your questions. Thanks for listening.